Okay, my name is Cheryl Norris. I'm a Senior Activation Manager here at SureScripts. What that means simply is that I work with our network health technology partners like MicroMD, along with our PBM partners and health plans that are connected for medication prior authorization. I will be one of your facilitators this morning. I'm going to kick off about the first 15 or so minutes. We'll be spending about the next half hour or so learning about electronic prior authorization and the functionality that's available to you currently in MicroMD. Judy, you want to go ahead and tell me a little bit about yourself?
Hi, yes, my name's Judy Cobb, and I am a training specialist with MicroMD, and I live in Texas and work with our clients regularly, so I'm happy to help with any of you going forward with any assistance you may need with getting set up with the electronic prescription process.
And Judy's going to show on her presentation, one of the last screens is going to have information about sort of the requirements for getting started, how you, reach out to request connectivity for medication prior authorization. So that will be detail that we'll show at the very end.
Right. It'll just be as simple as contacting support.
Excellent. Okay, medication prior authorization is one of the greatest sources of frustration for physicians and their support staff. Many of you can probably, raise your hand to that. About 80% of the prior authorization requests that are handled today outside of an electronic mechanism require extra work, rework. You're making lots of phone calls and you're receiving faxes, and all told, again, about 80% require rework. I talk to many nurses who say that they organize their question sets, forms, in a file folder in a drawer next to their desk, and anytime a prior authorization is required, they look for, they pull out that file, they look for the right form and hope that they do have the right form. Then they have to go through the monotony of recording all the information, so the patient demographic information, the provider demographic information, the information about the medication that the provider's wanting to prescribe, and then answer a myriad of questions, maybe up to 20 questions or more, maybe not really pertinent to that patient or that medication, but nonetheless, a lot of extra work, a lot of time pulling that information out of the medical record to send along with that prior authorization. And many times they tell me that they do all that work and then they later find that a prior authorization wasn't actually needed. So they spent all that time doing that work for really nothing. Statistics show that on average, physicians spend about 8 hours per week completing prior authorizations in the manual fashion. About 30% of a practice's inbound phone calls are from patients wanting to know the status of their prescription. So when their prescription requires a prior authorization, things get held up. And so those return calls that you're getting in your offices, 30% of those are patients looking for their medication. And then due to all the delays, an astonishing 40% of all prescriptions are never picked up, largely due to all the waiting and all the decisions that need to be made along the way. SureScripts CompletEPA program, we started about 2 years ago. We started with a pilot with one of the large PBMs and some of some health plans, as well as a couple of our health technology vendors, just to ensure that the concept and the idea was working, and we proved that it is. And now our network is really growing. People want an electronic way to facilitate prior authorization. We have about 80% of all of the providers that are connected to our network via an electronic medical record have the capability of utilizing electronic prior authorizations. We're the largest network for this service. We are a network, and we have 8 of the largest PBMs connected for electronic prior authorization. We also have third-party payers, which means if there's a health plan that's not yet connected to the network for electronic prior authorization, our third-party processors have the ability to get the information to that payer in electronic fashion. So it keeps the providers in a common workflow within their EMR instead of manual processes. Today, we have about 75,000 prescribers that are enabled on the network for this technology. And then in a year's time, we've seen about 13 times growth in the number of transactions that we're seeing across the network. What sets CompletEPA apart from other manual solutions is that SureScripts utilizes smart logic within question sets. First, you will always receive the correct form. So I mentioned before, those paper forms are a little bit frustrating in finding the right one. And sometimes when you use a portal concept for CompletEPA or for prior authorizations, I hear that you don't always get the correct form via the portal either. So gone are the days of searching through a file folder to locate the right payer's form. When you open the electronic question set, the provider and the patient demographics will be pre-populated, as well as some of the medication information based on the detail in the script. So we've removed the need to complete all the data that is necessary when completing the manual forms. And in addition, based on how you answer the first set of questions, will dictate and determine what subsequent questions may be required for that patient and that medication. So before we talked about having to complete up to 20 questions on one of those paper forms, our question sets are logical question sets. So again, how you answer the first 1 or 2 questions will dictate whether you have to answer additional questions or not. So the amount of time that you're spending is far less than what you are in the paper world. In addition, the initial median response time to get that real-time response back from the PBM is taking about 3 to 4 seconds. So near real-time, while the patient's still perhaps there in the office, in the exam room, and you're having that discussion about the prescription, you'll know whether that prior authorization is required or not. And if it is required, in that time frame, that 3 to 4 seconds, that response you receive will be the electronic question set, again, with all that information already pre-populated. You just have to start answering the questions. And if a question set is required, once that question set's submitted back by a nurse or another staff member or the physician, we're seeing a median response time from those PBMs and payers in about 39 minutes. 60% of the question sets that are returned, you get a response from the PBM in under a minute. So pretty good response time in comparison to what you're experiencing today in the paper world or in a portal processing fashion. If we were to map out what your workflow looks like today in a non-electronic fashion, it would largely look much like what you see on the screen here, with many handoffs and many decision points and a lot of time passed making those decisions. So the reason why these medication prior authorizations are such a problem and challenge for our clinical providers today is because it's largely a reactive process. What that means is the provider sees the patient, they order the prescription is sent to the pharmacy. When the pharmacy tries to then adjudicate the prescription is when they may receive a denial from the insurer. The patient arrives to the pharmacy, they're expecting to pick up their medication, and instead they're told that there's going to be a delay because their insurer needs some additional clinical information. Meanwhile, the provider and this nurse have gone back, they're seeing other patients, They have to get interrupted, perhaps, by the pharmacist when they reach back, suggesting that additional information is needed. The prescriber then has to get back into the patient's record, determine the patient's pharmacy benefit, identify the right form, again, to complete, determine if they use the portal, a fax, or some other communication to deliver that clinical information for approval. And then finally, after a few hours or even a few days, and if in the ideal scenario, the prior authorization is approved, you might then need to contact the pharmacy and then contact the patient that they may then pick up their medication. So the whole process, again, can take several hours to several days. And in some cases where there's highly specialized medications, we've seen it take about 4 weeks. So many of you probably have experienced that timeline. So this is just showing the process now that we've gone electronic. So, seeing this and how detailed it is in the number of handoffs with the electronic prior authorization process. Again, the provider can initiate that electronic prior authorization right in their e-prescribing workflow. They can see, based on the presence of a visual flag when they're prescribing the medication, if a prior authorization may be required or not. And the reason why I say may be required is that formulary and prior authorization flags are set at the formulary level. It's not until you actually attach the patient and send that off to the PBM are they actually able to determine, based on that patient, their history, whether they've had that prescription in the past, what the requirements are for prior authorization. As mentioned previously, within seconds, you may receive that electronic response. And it's going to come back indicating one of a few different options. So you might get that, the PA is not needed for that particular medication, patient, and health plan combination. So you can go ahead and send that prescription to the pharmacy, and the patient can stop by on their way home and pick up their medication. Or you might get a response from the PBM saying, for this patient, this medication, their health plan is not going to cover this medication. So at that point in time, the prescriber can have a conversation with the patient about trying a different medication. Maybe there's a preferred medication, a generic equivalent that would be covered by their health plan, or maybe it's flagged as prior authorization, but it's one that the patient's paid out of pocket for before, and that's what they wish to do. So having that conversation, setting the right expectations at the time of prescribing is ideal. And then a third option that might be received is obviously the question set. So we want to see question sets when those medications are flagged for prior authorization. So again, in that 3 to 4 seconds real-time check to the PBM, if a prior authorization is required, you'll receive that electronic question set. And again, based on smart logic, you're going to answer far fewer questions than you are in a paper process. The provider completes the question set, so they answer questions 1 and 2. Based on how they answered, they may skip down to question 5. They answer question 5 and then may be finished. And you'll see that when Judy shows you an overview of how the system looks in MicroMD and the workflow associated. So you send that question set off to the PBM electronically because they're connected electronically. They have decision trees electronically set up. A clinical person may not have to review that scenario for determination, and you could get that determination back, either approval or a denial, within a minute, maybe a few minutes, maybe a few hours, depending on the situation, the scenario, and the health plan. But again, far faster than in a non-electronic method. So if the health plan approves, again, you send that prescription off to the pharmacy. If they deny, some of the PBMs are set up electronically that you can appeal the denial. So they'll be, within the workflow of prior authorization, you'll be able to send information to appeal. So you might say, so why should I adopt this electronic prior authorization if I hadn't made the point so far? We are truly the only automated solution available on the market today. So because of our vast connectivity that we have with our pharmacy benefit managers and their health plans, you're going to get quick responses. They will receive information quickly from you, setting the right expectations with the patients. And again, back to the question sets, the fact that you're always going to get the right questions for that medication and for that patient. So it really streamlines the process and saves time. And this is a slide showing some of the comments, some of the testimonials we've received from our end users. Some of them are physicians, some of them are chief medical officers that also practice medicine. Some are nursing staff that are doing the processing of the PAs. Probably like in your practice, somebody other than the physician might be doing all of the prior authorization work, and that's certainly fine. Most notable here is the last quote at the bottom. This is a family practitioner, is also CMIO at a large health system in central Indiana. They have a large presence of health plan coverage for those connected payers on our network. And they went live last March 8th of 2016. And within about 2 months' time, they save so much in their nurse time and provider time that they estimate saving 14 full-time employee weeks per year when they've fully transitioned all of their physicians from a paper process to electronic prior authorization. So that's pretty significant. Again, using electronic prior authorization, you're able to set the appropriate expectations with your patients. When they can stop by the pharmacy and pick up their medication. If you know a prior authorization is in process, you might tell them before they leave, don't stop by the pharmacy to pick up your medication, wait till we get confirmation back, and either we'll call you or the pharmacy will call you and let you know that you can pick it up. And again, we're the only complete end-to-end electronic process available. So without further ado, I'm going to hand it over to Judy, and she's going to provide a presentation, an overview of the functionality that exists in MicroMD today. So Judy, I'm going to make you the presenter here.
Okay, great. Let's see. Here we go. All right, I've got it. So thank you very much, Cheryl. And now I'm just going to walk through and show you with some slide presentation screens here how this process will all work inside the MicroMD software. So let me get started. So the first thing is that you're going to want to keep in mind that you, of course, must have e-prescribing through the SureScripts network. And you must be on version 12 or higher with the MicroMD software. And you'll need the Clintegration of 12 or higher also, which would be installed by our team. And each one of your machines must have Internet Explorer version 9 or higher. And then you'll want to be sure that you save this URL as one of your trusted sites on your computers. And then there is some additional information in the configuration manual, which we're not actually going to look in the manual today, but just take note that there's a little setup information in the configuration manual. Now, once this process has been set up, then you'll be able to go into your EMR software, and under your Tools drop-down menu, you'll go under your User Preference tab, and you'll see that there's this section that you'll be able to add authorized staff members to help assist with the prior authorization process. So as long as you have your staff members set up in this area of the user preferences, then they'll be able to help with the process of authorization. And then when you're actually writing a prescription, what will happen is from your prescription pad now, you'll have this prior authorization required tab down at the bottom, letting you know that this medication that you're prescribing requires prior authorization. So at this point, you'll still go to authorize your prescription, and it's going to take you to your processor window that you're accustomed to seeing. And once we come to this processing screen where you would normally just go ahead and process the prescription, you now have a prior authorization indicator icon that will show up right here to the right of the medication that requires the authorization. And when you click on that button, you'll be able to see that you can go ahead and begin completing that process right now while you're writing the prescription, or you have the option of forwarding it to a staff member. And of course, this staff member would be one of your staff members that you've set up under that user preference tab that we just went over. And then if you start the process, this is what the screen is going to look like. Actually, I'll show you in a little bit in a few slides ahead. There is another screen that may look more familiar to you depending on which version of our software. One's yellow and one's white. But you can forward it to a staff member or begin the process here. And what you'll do is you'll click on the Start button, and that's where you'll be able to begin the process of answering the questions that's required to get the authorization. And it'll be the same questions that you're familiar with, and like Cheryl mentioned, it may be a few less questions in order to get the process completed. And then once you're answer the questions, then you will have this once the process has been approved or denied, then you'll have this processing screen that says Acknowledge Approval Denied button or Approved button, and you'll have to click on this button for the process to be complete. Now, from your desktop, you have the ability to have this button over here on the right-hand side that'll be available to you now that says Process EPA. And so you can actually manage this process from your desktop. So if the authorization was sent to a staff member to complete the questions, then they would be able to manage that process from the desktop here under their prescription area, or from the doctor's prescription area as well, or provider's prescription area. You can also add this area here now for your quick keys under your desktop tools menu. And in order to add this, remember you'll just click on this little gear next to desktop tools, and one of your options now will be the EPA prior authorization, and you can add that to your desktop tools, and then you can manage your processes from here as well. So they can be managed from the prescription area of your navigator or from this EPA under your desktop tools. And this is the other screen that I mentioned. So when you click on that EPA on your desktop tools or in your prescription area, you'll be able to see the tasks at hand with your work list and your task history, and you can click on the different authorization areas in this desktop area in order to manage your processes. this is your work list. So it's showing you your prescriptions that are awaiting initiation for EPA and the ability to process, and also your task history is showing all of your EPA instances that are in process as well as those that have been completed. And if you're interested, there's absolutely no cost for this additional feature as long as you're on the SureScripts electronic prescription writing process. And to get started, you can contact support and they'll assign a key code and help you with getting started with the process. So it's just that those few additional screens that have been added to MicroMD to help this process and help you streamline your electronic prior authorizations. And that's all I have to show you in the EMR. It's a very nice, smooth process.
Okay, it looks like we have some questions that have come in, Judy. So the first one here is they attempted to turn on EPA, but the PBM reported as INFRX, I'm not sure what that means, but was not included at the time, which is about 80% of their clients or 80% of their patient coverage. That sounds like a to-do for me. Let me take this back to find out where, do you know, can you tell me the name of the PBM? That will help me. You know, we have the large PBMs connected to the network. There are some that are not yet. Some are close to connecting. So if you could tell me the name of the PBM or the health plan, I can do some research to find out what status they're in and can let you know that via Judy or Amy. Oh, it is INFRX. Okay. Okay, I will check into that for you, Lee, and we'll get back to you. And Debbie Vota. Okay. Thank you. Any other questions? We have a quiet group here. Okay, well, if no other questions or if you are in the middle of writing a question, I'll just sort of summarize, you know, really at the end of the day, what we'd like for you to take away from this presentation is that electronic prior authorization can significantly reduce, decrease, eliminate the need for forms, faxes, web portals, phone calls that are associated with prior authorization today, significantly increasing your efficiency and ultimately improving both clinician satisfaction and patient satisfaction, and getting that medication, that treatment to the patient much more quickly. It looks like we have another question. How do we know what prescription coverage a patient has? Often it is not the same as their health insurance. Judy, would you like to address that, or would you like me to?
You can. I believe that, of course, our system is going to try and process the medication based on whatever insurance we've added into MicroMD. But if you want to address it further than that, you can.
Yeah. So SureScripts on a regular basis. Regular means several times a month. As health plans have new members into their health plan coverage, they're uploading files to SureScripts with that patient information into our master patient index. So ultimately, when you're doing your nightly eligibility, so as your patients are scheduled into your provider's schedule the day before, the week before, the night before the appointment, MicroMD is running a process in the background that's going out and looking, they're sending requests based on that master patient index at SureScripts They're identifying the patient, and we're helping identify what eligibility that patient has based on our information that we have. Part of that, too, is the information in your practice management system that you've identified that patient having coverage. So as that patient checks in, your reception staff might update their demographic information in your computer to reflect what insurance, if they have multiple insurance, what's their primary and their secondary. So you're getting the eligibility data based on, and formulary data based on all of that information. The medication, as I said earlier in my presentation, the medication, the formulary is flagged at that medication level. So if sort of the logic that the PBMs use is if a prior authorization might be required in 55% of all patients, then they will flag that medication as may needing a prior authorization. Because we know every situation is different. There are coverage limitations. There might be age or gender limitations where a prior authorization might be required for a patient that is not meeting the age requirements specified by the medication. That would always require a prior authorization, where if somebody is within those guidelines for that medication, either the quantity, the age, the gender, then they may not need a prior authorization for that medication, although that medication is flagged. So that's where that real-time transaction is helpful to say, okay, I've got this patient, attach this medication, do they really need prior authorization? And then you get that response back. We see about 30% across the network where you get a response back saying a prior authorization is not required for that scenario. Does that answer your question? Is there a backup way to know if the doctor does not forward the PA to you? Judy, do you want to answer that?
That's a good question. I'm not sure of the answer of that, but I can certainly look into it. I believe that all of the workflow is going to show up on that workflow screen. So as long as he either clicks the process or forward button, then you'll be able to manage the process from your workflow screen. So nothing should be lost.
Okay. And I accidentally skipped a couple of questions. So what is the success rate? The success rate, I'm not sure what you're exactly asking. I'm assuming you mean success rate for an electronic prior authorization versus, so there are some scenarios where that patient's particular health plan is not connected to our network for electronic prior authorization. I will tell you all of our PBMs are working on getting their health plans connected, but it is a process. It's not as easy as flipping a switch. There's often development resources and such that are required to activate a health plan. And then that health plan has to provide all of their formulary data with the prior authorization data included so that this is going to work. So there are times where you might get a response back that says, unable to process prior authorization electronically for this patient. And then they'll give you, in that PA note on that screen that Judy showed you that had the prior authorization information on it, the PBMs are going to return a note that tells you what to do next. So whether they'll send you a form via fax or they'll have you call a particular number. So there are still some health plans that are not yet connected. So on the front end, you'll continue to do the same process as Judy outlined for you. But on the back end, actually getting that information to the health plan may require you to complete, unfortunately, a paper form. Every day we have new plans joining the network. So, in hopefully short time, we'll see that you can do 100% of your prior authorizations electronically. Let me back up here. There's some more questions. All very good, thank you. Can you see the patient's chart while accessing the prior authorization, Judy? So if they need to research the chart to provide an answer to a question, maybe they want the last PSA results or something.
Well, you're going to have access, let's say you're prescribing a medication and you're in an encounter. So if you're in an encounter, on your ribbon bar, even when you're on your prescription page, you'll have access to your patient monitor, which can take you into all of the different areas of the patient chart. So if you're accessing it from there, yes. If you have a patient chart open and then you open up the authorization work list, it'll be open on top of your patient chart. So the answer to that question is yes.
Okay. And then another question here, can this be done only through the prescription pad, or can it also be done through the encounter?
No, the prescription pad is available to you in the encounter, or from your desktop area. So absolutely, when you're on the step for medications in an encounter, then it will be the exact same process that you're writing a prescription now. So if you're in the encounter and you're on your medication step, as you write the prescription, the only difference is that now you'll have the prior authorization needed in red down at the bottom right area of your formulary page. And then when you actually get to your authorization page, you'll have that new little EPA button. So yes, absolutely, this can be managed from the encounter.
All right. Another question, how does this work with Medicare Part D? So there are several of our large PBMs that have Medicare plans connected to the network. So same way. So if a PA is going to be required, they'll return to you the electronic question set, which you'll submit, complete and submit back, and that you'll get a electronic determination. There are some Medicares that are a little bit sluggish, and Medicaid as well. Some of the state plans are a little slower, again, because they don't yet have the technology available to connect, or they're just not in that process yet. So you may get a response back to let you know that the electronic PA cannot be processed electronically, or the PA cannot be processed electronically, and they'll provide you with what are the next steps. So that is true. There are some gaps that we're still working through, the health plans are working through as far as connectivity. Another question, does the EPA report back us and also come back to us and also to the pharmacy? Yeah, so when that determination is made, the pharmacy, when they go to adjudicate that medication, they'll be able to see what the ultimate decision was for that health plan. The approval rate is higher than the denial rate across the board. I wish I had the statistics that I could tell you off my cuff what those are, but I don't. I get a monthly report card that I dish out to all of my PBMs and all of my health technology vendors, just so they can see how many transactions were sent across the network by their providers, how many question sets were delivered, how many were responded to, what were each of the statuses returned by the PBMs. Was it a closed approval? Was it a closed denial? So I do see those statistics regularly. I just don't know what that is across the network, but I will say, yes, there are definitely more approvals than there are denials. The PBMs have done a great job building in logic into these electronic question sets, that essentially the reason why it's so much more efficient and you can get that determination quicker is they have built-in smart logic and protocols based on how the questions are received they go through some logic and will sort of auto-determine the status of that prior authorization. So the fact that it doesn't have to go through people to make those determinations in most of the cases is why you get that back so quickly. How many of our elderly patients have no clue what prescription coverage they have? We would enter their Medicare number in the PM system, but often never receive pharmacy info. If they do not give it to us, where would it go in the PM? So this is where our SureScripts Master Patient Index, the fact that the health plans provide us all of their covered lives, so all the patients that have coverage through them, would help flag the formulary when you're doing an eligibility request and to get that eligibility response back. Based on the Master Patient Index and who those health plans say that they have covered lives for, is then how the transaction is routed to which PBM. And then they would return to you specifics about, so they return to MicroMD specifics about that coverage, and then MicroMD uses some algorithms within their system to be able to show you the formulary and eligibility information for that particular patient. So there's a lot of smart logic happening in the background that populates that information to the prescriber at the point of prescribing. And I hope I didn't confuse everyone by that. It's a little complicated, but it works really nicely. If the medication is denied, can you do an appeal? So I noticed on one of Judy's screens there, I think there was it showed appeal option with an N as a no. So they are looking, MicroMD is showing you in the background for that particular PBM or health plan if an electronic appeal is an option. If it isn't an option, if it is an option, you will see within that screen you'll have opportunities to click to make the appeal and then to populate a text box with information about why you're appealing. So yes, some of them do, some of them aren't quite there yet, but you'll know when you're in the screens which ones you're able to do that electronically.
Would that be on your work list page?
Scroll down to it was in one of these work list screens. So it might have been within an actual task.
Okay.
No.
Those were my only work list pages that I had, were these two pages.
Click through there again. So right here, okay. So you see the PA approved on the left-hand side under David Cross's name. It says patient David Cross again, the date of birth, and that says e-appeal supported with an N. So that tells you by looking at this that this patient's health plan does not support an electronic appeal. If it did, and it was denied, then you would have an option on the screen to go through that appeal process. Okay. Let me go to the next question. Oh, you guys are doing great here. Can you do specialty drugs this way? Absolutely. So your formularies are going to be flagged by the PBMs if prior authorizations might be due for those or might be required for specialty medications, and we know that many of them do require. What they might have you do is go through the process of completing the prior authorization electronically, and then because they have sort of a twofold process to get approval for specialty medications, they may then fax you a secondary form that's not a prior authorization, but something, a subsequent piece of information that they need to have you complete. And that's just, they may. That isn't the situation in all cases. But yeah, specialty medications can also be done electronically. From the encounter medication portion, does the provider have the option to forward it to staff?
Yes.
And Judy, if you want to, I don't know, remember which screen that is on, but if you want to show that, that might be helpful.
Okay. Let's see where we are. Hold on. It's one of the first slides I showed, so let me just go back. Yeah, so if they're in the encounter, you'll be able to choose to forward to the staff right from here. It's the same processing window that you have in your prescription in your encounter now. So the only thing that's changed is that now you have this EPA button, and then you can complete or forward to a staff from this screen.
Thank you. And then I do see your follow-up, Lee. I've got your email and your contact information. So as soon as I find out about INFRX, I will be in touch with you. Looks like we have a couple more here. If the prior authorization is for preferred formulary only, will it list the preferred medications? So Judy, how in MicroMD are you displaying preferred formulary information once they select a drug? Do you show the preferred medications if the one they've selected?
So you're able to see the preferred medication would show up under your formulary details screen. And then you've also got your alternative medications down below, generics and so forth. So it's going to show when you go to write the prescription, just like when you write the prescription now, it would show if it's a restricted medication or if it needs authorization. That's the new feature. And then, so your formulary details window is the same that it's always been, other than now if it's a medication that just requires prior authorization, then you're going to get this new indicator letting you know that.
Okay, and Diane, yes, our plan is to send out to all of the attendees the copy of the PowerPoint slides, as well as a link to the webinar. So we'll get those sent to you probably into next week. I'm actually on PTO tomorrow, and there's a bit of prepping I need to do in order to make that happen. So. Okay, does the EPA button show if prior authorization is not required?
Well, if prior authorization is not required, then the EPA button is not going to come up for you to address that. So if the prior authorization is not required and you go to prescribe a medication, whether you're in the encounter or whether you're on the desktop, prescribing an electronic medication, then you're just going to use your prescription pad as you normally would, and then this red area that says prior authorization required will not be here, and you'll just authorize the prescription as you normally would. And then when it takes you to that next page where you're processing the prescription, you would not have the little EPA button in order to manage that process. So it's only going to show up for those prescriptions that require the authorization.
Okay, I think we've concluded with all of the questions. Thank you very much. Those were all great questions. I just want to thank you for your time. I know you're all busy folks, have busy schedules, and we appreciate you taking an hour of your day to spend with us to learn about prior authorizations. If you have any follow-up questions, feel free to reach out to the support staff at MicroMD, as Judy pointed out. Anything else, Judy, that they may need to know about?
No, I believe that's it for now.
Okay. And again, if you'd like to sign up to have the functionality, I think you'll have a really good experience, and hopefully you'll be one of those that we get testimonials from in the future about the time savings that you and your patients have seen through this electronic prior authorization process. So again, thank you for your time. Thank you, Judy. Thank you, Amy.
Thank you.
And have a great rest of your day.
All right, thank you, everyone.